We did ask about what it would be like to deliver if I had COVID. Welcome back to my channel. My name is Jessica for those that are new here. This is Eric and we are...
Like if they don't know me.
Eric. But some people are new. We're getting a bunch of new people.
No.
Anyway, so he wasn't trying to be rude, but
no, I wasn't.
This is Eric for those that are new here, like I said. But if you've been around, you obviously know who we are. But anyway, so we are at our doctor's office, about to go in for my 34 week appointment. Really, we're probably just gonna check on baby, see how he's growing, and then check my cervical length.
Is he doing an ultrasound?
Yeah, it's an ultrasound. So they've been monitoring me pretty closely. I've been having 2-week appointments to just measure my cervix, because a few weeks ago they found that it was a little bit shorter than normal. So nothing to be too concerned about, but my doctor still wants to make sure that it's not getting any shorter, and that I'd be at risk for preterm labor. What do you...
I don't know. I didn't even know they're doing ultrasounds. Kind of a lot of ultrasounds.
I know it's a lot of ultrasounds, but they said ultrasound, so I'm assuming that's what we're having.
I didn't know they do this many during a pregnancy.
I don't think they do. It's just because my cervix. So unless they do like a cervical exam, but they usually check that with an ultrasound. So they're gonna do that, and then yeah, they said they were gonna hook me up to the NST again to make sure that I'm not having any contractions. And I mean, that's really it. After that, we always speak to the doctor, and if we have any questions, he answers that then. Which
I do.
Yeah, so what do you want to know?
Like if he's gonna let you go full term, a week longer, if he's gonna just stop you on your 40 weeks or go a week longer. Yeah. What's his plan? Some doctors do let you go past your due date, but yeah, there are we have an idea for, like, we could let our employers know.
Yeah, right now I feel good. Like, I'm not having any contractions that I know of. I don't know when Braxton Hicks start, but I don't think I've had any. And what else? Yeah, I feel good, so I don't see why I'd go into preterm labor. Obviously, we'll have a clearer idea after this appointment, see how my body's doing. There's just a few questions I have too. I want to ask my doctor about delayed cord clamping. So I want to see if that's something that he does, or if it's something that he recommends. I know there's a lot of research on how you may have to go pee. I know there's a lot of research on the many benefits of delaying cord clamping, so if that's an option, I think I want to do that. And then I also want to ask if, you know, God forbid we were to get COVID right before delivering, like how that would affect labor. My guess is, say we both had COVID because we live together, I don't think you would probably be allowed in the delivery room.
Why would you be allowed? No,
I kind of have no choice, but
well, we don't have COVID.
We don't. We've been really good, but we're getting so close to, you know, baby being here that if we were to get COVID, yeah, like.
Well, we'll just ask them if they're gonna keep them away from you for 2 weeks.
Yeah, I want to know all that. It's just something that I've been thinking about, like if I were to get it, yeah, what would happen? But anyway, I think that's kind of...
We'll give you guys an update here after the appointment.
We're gonna be late. Yeah, we're gonna be late, so we'll update you after the appointment.
Head down still.
Okay.
Move as much as you want, as long as you keep head down.
Do they flip? Like, are the chances like pretty low now, hopefully?
Yeah, I would definitely confirm that with Dr. Lorenzo, but I feel like, I feel like there's always a chance that it could happen, but I do believe it's a lot low, like the chances are lower.
Okay.
There's a little heart beating right there. .150, which is normal. How has he been measuring?
Last 2 times I believe in the 70th percentile.
Okay.
That's what they've been telling me.
Okay. Baby's still practicing the breathing. You see how the whole abdomen right there is just like kind of pulsating. That's so pretty. Showing off. I felt that one, whatever that was.
Yeah.
Whatever that was. Felt that.
They're strong.
He's like, leave me alone. Take one more set. Usually if they're measuring either ahead or behind, usually we measure everything twice.
Okay.
Which I already did.
Yeah, no, I'm just surprised because, this is my first pregnancy.
Yeah.
But people always tell me I look small.
And you're like,
Yeah, I'm like, he's big though. Like, I don't understand. And then, do we check my cervix too, or not at this point? Because I know they were monitoring it, Dr. Lorenzo was.
Okay. Yeah, we always try to look at the cervix if we can see it. Sometimes we don't.
Yeah.
Sometimes. Do one more head measurement and then I will. Is your cervix shortened?
It was, it was. But then the last 2 appointments, or is it 3? I forgot. It's been stable.
It's been stable? Okay,
yeah,
good.
so then he wasn't really concerned after that.
Okay, good.
He said, I'm here to mention it.
Yeah. Yeah, we always, with every appointment, we try to look and see if we can see the cervix. We don't always see it, but...
Yeah, I want to say last time she wasn't able to see it either.
Okay. I'm going to apply a little bit more pressure, okay? Once they get bigger and once their little heads are down, it usually kind of shadows out the cervix, so we have a harder time actually, visualizing it pretty well. Alright, here comes the pressure, okay? It was hard, but as much as you can, just kind of try to relax. Are you doing okay?
Yeah.
Okay. Sometimes that extra pressure kind of will move their heads up a little bit. And you said this is your first pregnancy?
Yes.
Okay. So we have nothing to compare it to. That's okay. Fluid level is great. Were either one of you bigger babies when you were born?
I think I was average, and he was actually small.
Okay. Okay, this is gonna sound weird. I'm gonna have you cough a couple times. Baby's still practicing his breathing. That's going for it. I love it. Here's baby's little lips right here. Between the hands and the placenta, I swear. They're like so sneaky. You just want to cover everything in there. so 76th percentile.
Okay.
Weighing 5 pounds, 11 ounces.
Okay.
But everything looks good.
Thank you.
Yeah, we're all done.
Are these fun?
This is long.
I know.
What? 15 to 20 minutes for the ultrasound?
Yeah. No, but at least they have me inclined because it's getting more uncomfortable to be on my back. I feel out of breath.
From moving?
He's moving around a lot.
No, I mean from you, like, squirming to get comfortable.
Yeah, like, even just cooking. Like when I'm chopping food, I feel like I'm out of breath. But he just moves around a lot, so I think like he just pushes on me all the time.
Mm-hmm. Good.
Strong heartbeat.
Oh, 142, 143.
Is that what it's saying?
Mm-hmm.
I didn't know it was saying it.
Mm-hmm. It says a heartbeat on it.
Cool. Oh. You guys are so needy, huh? Okay, so we're back home. We're just in bed. It's like so cold today. So just wanted to be comfortable. But the appointment went really well, I'd say. Baby is, the heartbeat looks perfect. He's measuring in the 76th percentile. She did measure twice. So the first time it was actually, was it 84?
It was 84.
84, and then she did another measurement. Like she measured everything, and then that's the one where she came to 76. So I guess it could be somewhere in there. I'm really hoping it's closer to like the 76 because I'm the one that's gonna have to push this baby out, so I hope he's not too big. He is head down, so that's good. Chances are he'll probably stay that way. He does move around a lot, so I worry that maybe he'll like flip, but I don't think he will.
No.
He's so active though, and at every ultrasound I always get told. But yeah, I can feel him all the time. And
what's funny though is she feels him all the time. We go to ultrasounds, they see him moving. Ollie.
Oh. Ollie.
And the tech sees him always moving, and then when Jessica's always like, come fill him, I go fill him, and nothing. It's like no movement, nothing. It's either he doesn't scared of me, or
I always tell Eric either he hates you or he feels safe and like calms down. So I guess we'll find out once he's here. But yeah, like he moves around all the time except when Eric has his hand on my belly. So that's kind of funny. But yeah, he's really active, and now everything looks good. My cervix is, I believe,
hasn't changed.
No, yeah, she said it hasn't changed. So I don't think we're like concerned about that anymore. At least my doctor isn't.
No.
They still hooked me up to the NST machine, and I wasn't having any contractions. So there's no sign that I'm going into labor anytime soon. He did say that we would just try for like a natural labor, meaning that he won't induce it. So hopefully my water breaks. But yeah, I think that's the plan.
Yeah, it's from what the information he has now. That's what he's going off of.
Yeah, he said, baby looks good. I don't have preeclampsia. I don't have...
He has enough fluid.
Yeah, he has enough fluid. Cervix isn't short. No high blood pressure. He said, so like really no reason to like induce or schedule a C-section or anything like that. So everything looks good as of now. And we did ask about what it would be like to deliver if I had COVID, and he said they would just obviously wear masks and like
You would wear a mask. They would wear pretty much like a jumpsuit.
A hazmat.
Pretty much a hazmat suit,
yeah,
so that way they don't get no droplets.
Yeah. And he said that as of now, I don't know if, I'm assuming they've delivered babies with, you know, in that circumstance, because he said as of now, like from what he's seen, they haven't had to like separate baby and mom. But I don't know. He said that if I had it, they wouldn't separate me and the baby. Again, that's like worst case scenario, but still something that can very much happen due to, you know, everything that's going on right now. But hopefully we can stay safe and healthy, and, you know, don't even have to worry about that.
They do, I guess, for the hospital we're being seen at, they do test prior of her going in. So
they'll have me take a COVID test and, you know, determine if I have it or not, regardless of whether I'm showing symptoms or not.
You asked about the pre-clamp.
No, I asked about the delayed
that
cord clamping, and he said that that's what he normally does anyway. So that was, I guess, the plan all along. He said he usually just waits 1 minute because there's really like no greater benefit to delaying it any longer than that. So he'll wait a minute and then he'll clamp the cord. And
okay, before you continue, when you mentioned it earlier, I was so lost.
Yeah, I don't, it's just Eric.
So explain.
Eric doesn't
I don't do as much research as she's doing.
Yeah, I research everything.
She just tells me.
Check like numerous apps like every week to see, you know, where I'm at, what I should be asking. If there's something that stands out, I do the research. Okay. So the delayed cord clamping is basically the like the umbilical cord.
Oh, yeah.
Before they used to like clamp it right away so they could cut. So if you delay the clamping of the cord, research shows that there's like a lot of benefits for the baby, because he's receiving that like blood.
Oh, okay. So they'll wait a minute, leave it connected, clamp it, and then cut.
Yeah.
Pretty much it.
Yeah, I mean that was it was pretty like quick, basic, nothing too special.
Yeah. And then you go what, every week after the next appointment?
I'll have a 36-week appointment, then after that we'll follow up every week. And yeah, basically just watch for
some
labor signs.
Yeah, labor signs.
Yeah, so in the next appointment I'm going to have the Group B strep test. And if you didn't know, that's just basically to to see if I have okay, so that's basically to test to see if I have this type of bacteria that lives in the body. Usually it's not too serious, at least not for the mom, but from what I read online, it's more dangerous to the baby. So that's why they like to test for that. And if I were to have it, he said I would just be treated with antibiotics and
during the whole labor.
And yeah, I mean it's a pretty simple treatment, but if obviously it goes untreated, then it can be pretty serious for the baby. So I hope I don't have it, but if I do, I'm glad it's like nothing super intense, and it can just be treated with antibiotics. But yeah, that was basically it. Feel good, and I'm just getting excited that we're getting so close to delivery, to meeting the baby.
Are we?
Yeah, 6 weeks is like
I know.
Yeah, it like seems, nothing.
well, a couple months ago when we first started, it seemed so far away.
It really did.
Holidays, winter, made it go by fast.
Yeah. Alright guys, well that's going to be it for this video. Hope you enjoyed coming along with us for this appointment. I do have a few other videos planned. I want to start organizing the nursery because I really need to do that. We basically have everything we need. I just kind of just need to wash everything and then just put it away. And then I also need to start packing our diaper bag, or his diaper bag, and our hospital bags. So those are on my to-do list, but yeah, we're getting there. But anyway, I hope you guys enjoyed this video. If you did, don't forget to hit the like button and to subscribe to my channel, and I'll see you in the next one. Bye.